All right, so welcome back. Let's continue then to this. After 4 years on the front lines of a humanitarian crisis in Mozambique's Cabo Delgado, Médecins Sans Frontières is packing its bags in Mueda, but for a reason that offers a rare glimmer of hope. Since 2021, MSF has been the backbone of healthcare for thousands of families fleeing conflict, providing everything from life-saving surgeries to critical mental health support. For more on what this transition means for the community and how they ensure no patient is left behind as the international teams depart, we speak now to MSF's spokesperson, Barbara Trattnig. She is also the Deputy Medical Coordinator in the SADC region. Barbara, very good evening to you. Thank you so much for your time. Perhaps let's start with what specific medical or even stability milestones have been met, that triggered this decision to hand over operations to the Mozambican Ministry of Health at this particular time.
Good evening, everybody. It's always a quite big dilemma to go and to pack our bags.
Yeah.
But it's the usual dilemma which we have with MSF in particular, because we are an organization which is responding to health emergencies, which is always quite challenging, and especially in Mozambique, we were really working hand in hand with the Ministry of Health to ensure that we give them all the tools that they can continue the work. So we, as you mentioned, we started the work 2021 in Mueda, but not only in Mueda as well. We were working in two other different districts, which were the neighbors of Mueda, which is Nangade and Muidumbe, where we saw 2021 a very big influx of people which were fleeing a cost of the violence. And based on this, we saw as well that there's the big need for access to health, especially taking in consideration that a lot of health facilities were as well destroyed, and as well health workers were not there because they were fleeing as well. So that was the reason we entered 2021 in Mueda, Muidumbe and Nangade district. And then within the time, we were there 5 years, the decision was taken to hand over again to the Ministry of Health with a big plan of capacity building, on-job training, and to give really the tools to the Ministry of Health. But during the 5 years, we were working a lot with the communities, with community leaders. We were working as well with community health workers and traditional birth attendants to ensure that especially the community is aware which kind of health facilities are in their district or community, and to ensure that there's a really good referral pathway. During these 5 years, we were working as well a lot to ensure that chronic diseases are seen, especially taking in consideration HIV and TB, because as you may imagine, patients who may have to take medication on a daily basis don't have the access anymore due to the fact that the health facility where they get normally the medication were not available anymore, or they were not aware where it is. So our pharmacy team was really working together with the Ministry of Health to ensure that there's always sufficient medication available for these patients.
So Barbara, I mean, you are not just the spokesperson of MSF, but you also take care of the SADC region as the Deputy Medical Coordinator. I would imagine there are a lot of nerves as you pull out, given that MSF has been the backbone of healthcare, as we've said there in our intro, for tens and thousands of, families in that particular region. But speak to us about, how MSF specifically has ensured also that the local healthcare system has those specialized training to maintain these specific high need services. I mean, what were some of the interventions that you needed to make, and did that take the 5 years that you spoke of earlier on?
Yeah, it for sure take 5 years, because we were not doing the 5 years the whole thing.
Yeah.
So it was at the beginning we were really ensuring that the health facilities were rehabilitated together with other organizations, and as well at the beginning we were really focusing on the interventions to ensure essential health services in the IDPs and communities were put in place again, and we started to organize mobile clinics together with the Ministry of Health, and as well we started to rehabilitate health centers which were dedicated to do so. During these 5 years, we were really working a lot with the Ministry of Health to ensure that they have the capacity to continue the work which we put in place. And as well, in Mueda, there are still other actors which are working for specific parts. So specific parts were handed over to other organizations.
And do you think that, from an emergency preparedness perspective, in the event, of a new wave of violence, if that were to strike Mueda, are you comfortable that in the event of any eventuality that all of those interventions will hold? I mean, questions, of course, around what emergency re-entry triggers or even contingency plans you've put in place.
Yeah, so the good thing of Doctors Without Borders is that we are really flexible and having operational flexibilities.
Yeah.
For example, there was a high influx end of September and October in Mueda. At the same time, we were closing the project Mueda, but at the same time, we put in place a team who were working for a few months in the camps where we saw a higher influx of patients. So it doesn't mean when we close now Mueda that we will never come back.
Yeah.
But we try to give as much preparedness to the Ministry of Health, who is the owner of the health system in Mozambique.
Yeah.
So.
And just from a resource perspective, I mean, how does the closure of Mueda allow you then to, redirect those resources, particularly when you look at some of the more, volatile as well as, precarious areas, frontline districts in the region particularly?
So, Doctors Without Borders is still present in Mozambique. We still have 3 projects ongoing, but one of them is in Musimbo de Praia, the other one is in Palma, and the third one is in Macomia. And currently we are having as well one emergency response in Nampula for cholera response, where we are supporting the Ministry of Health. And as well, we just closed one emergency intervention in Erati due to violence, influx of displaced population. So that's the good thing of Doctors Without Borders, because we really try to have our operational flexibility, even though we have as well projects running.
Yeah. And just from a personal accountability perspective, from your point of view, just how satisfied are you that, the interventions that have been put in place, given, also the experience that you've had over these years, that, this plan is watertight as possible?
Yeah, it's always the biggest dilemma of Doctors Without Borders is due to the fact that we are a humanitarian organization which is responding to emergencies. We are not able to continue our intervention until until this basis that we say, okay, now it's super acceptable.
Yeah.
So that's always the biggest dilemma in as well in my personal experience, and in other contexts, Doctors Without Borders is coming back after a few years due to different reasons, but then you can reconnect with what you started sometimes.
All right, Barbara, thank you so much. I really appreciate your time on the program. Barbara Trattnig is the MSF spokesperson, as well as the Deputy Medical Coordinator in the SADC region. Appreciate your time on the show. All right, we continue with more news on the other side of this.